my name is Liz Clark. I am a certified personal trainer and strength and conditioning coach, and I work through the YMCA. I'm here with my model Karina today to share some injury prevention exercises as well as post-operative rehabilitation exercises. We're going to start with exercises regarding our knee. So first, Karina will be our model today. We will give you modifications as well, as we know everyone is a different capability. We're going to start with our classic hamstring stretch. So having Karina use a chair, so you at home could use the back of your couch, table, chair, bed, whatever that may be. We're going to have you put your leg up on whatever you end up using. Common error that people make is they open their hips up as Karina has here. So to really make sure we want our hips to be looking forward. So both hip points will be staring forward towards your foot in front of you. Another common misconception is we will relax our toe and or bend our knee. We want to try to have a nice straight leg and flex toe. So you're drawing those toes towards your shin. So hips forward, legs straight, toes pulled to the shin. From here, you picture yourself hinging right at your hip line, right? So Karina is very flexible, so she's going to hinge forward, taking her belly button towards her knee and reach out for her foot. This is a great hamstring stretch to the back of that leg. This is, again, really great for injury prevention as well as rehabilitation exercises. If you can't reach your foot, that's okay. Maybe you're just at your shin, knee. Some people just standing with your legs straight and no fold, so just standing upright, is a very intense stretch. So you modify as you need, just remembering to keep our hips forward, legs straight. Next stretch, Karina, you can come out of that, will be just a classic quadriceps stretch. So that will be our thigh quad stretch. So also using something to balance on, again, back to chair, table, whatever that may be. You're going to take one foot in your hand, grabbing in front of the ankle or on top of the laces of your shoe, and try to draw your heel towards your glute, towards your buttock. And again, not all of us can get our heel that close to our body. So you may need to use a strap, a towel, and wrap it around where your hand holds, or even just release the stretch a little bit. Notice how Karina's standing nice and tall. She does not have a hinge in her hips where her bum kind of drops back. She's standing nice and tall. Similar concept as with the hamstring stretch. Hips are looking forward. We're trying to keep nice long lines in the body. If you want to take this stretch a little deeper, you can feel yourself pull your thigh away from the front side of your body, and that can take that stretch a little deeper into an area called the hip flexors, which we'll get to a little more later. Also, when you're doing this, you feel as if you're pushing into your hand and pulling into your foot. So kind of that counter action happening there. So classic quadriceps stretch here. Thanks, Karina. Another area which can cause pain around the knee, so we want to have focus on, would be our IT band, running from up here outside of our glute area, down attaching to our knee. So again, using a prop of sorts at home, chair, table, back of the couch, bed. We're going to do a standing pigeon or standing figure four stretch. So taking your foot up, you're going to kind of let that knee fall open. And to protect the knee, again, if your pain is maybe a little chronic than others, you want to flex your foot, so draw that toe towards your shin again. And those hip points, just like the other stretches, are staring right forward, okay, towards the wall or the imaginary wall in front of you. And standing up straight again could be really intense for some of us. Karina, again, has nice flexibility throughout her hips, so she's able to fold forward. And you can hinge forward, you can even roll down forward and kind of take your head towards your foot. Karina, come up out of that one. So Karina's going to pretend like she's not flexible. I'm going to come around her side. Some of us, just so you know, our knee may be really high, okay? So this is where you'd really want to flex the foot to protect that knee joint. And that's okay, you just wouldn't fold as deeply. But our goal is to kind of get this hip to begin to open up. It's a nice IT band stretch. So coming out of that can be uncomfortable for some of us. So I have another one that is an IT band stretch. So we're going to cross our legs, Karina, and then reaching overhead, we're going to make a nice C shape with our body. So see, she kind of makes this half moon C shape with the body. You can feel as if you're reaching towards something above. You can actually even hold on to a door jamb, for example, with these upper hands. And so this cross body stretch gives a little bit, instead of around the knee joint stretch, it may identify more up towards the hip. That kind of helps in that hip flexor region as well. Come up out of that. And moving from IT band, we'll now go into just the classic calf stretch. It seems so basic, classic runner stretch. So Karina's going to look towards the wall. Let's put both hands on that wall. Taking your right leg back, we're gonna have a nice straight back leg, and then the front foot is gonna step forward closer to whatever wall, chair, again, whatever you're with. And this is going to be a straight leg stretch. And notice her heel's on the ground, so we're gonna focus on having your heel straight to the ground, driving that heel to the ground. To make this stretch go a little deeper, you can keep this straight leg and sink your hips. Try to keep that straight leg. And sink your hips, and you may feel a little more stretch through your upper calf muscle. So there are two parts to a calf where we want to get a little bit lower on this next one. So we will actually take this back leg and bend at the knee. And again, try to keep the heel driven to the floor, but this is the lower part of the calf muscle. Okay, so straight leg, Karina, show that one again, and then you move into bent leg, just bending that knee. So it's just a micro movement, it's kind of awkward, but promise me it does the trick. You can come out of that, Karina. Finally, we're gonna have Karina use a mat to protect her knee. So taking one knee on the ground, if you don't have a mat at home, that's okay. You can put a towel, pillow, whatever it may be underneath of you. So taking a lunge format, notice she's very upright here, which is fine. Some of us may be upright to start with. The side that your knee is on the ground, we're gonna raise our arm on that side. So we're opening this whole front side of the body. And then to advance this, we're gonna have Karina start to kind of lunge forward. So lunging forward, her bum goes with her, and then she's gonna come back up and out of that, and then lunge forward again. So we're kind of warming up our body a little bit to this, come back up and out of it. Now let's step forward a little more. So as you get more comfortable with this, notice the distance. Her knee is still over her ankle, and we're sinking the hips forward, lunging forward. So let's pause here, and now let's try to bring our upper body upright. So again, it's this back hip, not the front side, it's this back hip that we're focusing on here. Hips are sunk forward towards the front heel as much as we can, and as we showed you before, you can start with a shallower step. Karina again has mobility, so she can have a longer step here. We're lunging forward, and as you're here, you just kind of have this little micro movement in your head. It feels as if you're taking your tailbone and you're tucking it underneath. So shifting that tailbone underneath, that'll access a little more to that hip flexor on this side. And then a final advancement would be opening to the side with the leg back. So Karina's gonna open towards me, turn her whole body, hey, open towards me. And this is another advancement in this exercise. Again, she's keeping the lunge forward, the hips are sinking towards that front heel, her tailbone's tucked under, and she's keeping that length. So really nice hip flexor stretch. You come out of that one. So all of these stretches we definitely recommend you would warm up a little bit before. That can look different for everyone, whether you're walking on a treadmill, elliptical, spin bike, whatever it may be. If you're doing this for knee rehabilitation, you most likely be using that spin bike, but just something nice and light, get blood flowing before you move through these. This can also be done as a cool down to any sort of exercise routine that you may have. With running season coming up, we recommend these exercises.